Maybe we move to Prof Anand. So because you are right there on the front line, right? But you are surgeons. So what do you think from an end user perspective? What is the ground reality of AI in Malaysia hospital today?
Thank you and good morning to everyone. So I think it looks like most of the audience is from Malaysia, so you're familiar with our landscape. We have a dichotomous healthcare system. We have a very vibrant private sector which works alongside in parallel with an equally vibrant but perhaps overburdened public sector. And at the present time, of course, there's very little integration or meaningful crossover between the two. So I'll share a perspective from the private sector because presently that's where I work. So I'm practicing as a cardiothoracic surgeon at 2 quaternary hospitals, private hospitals in Greater Kuala Lumpur. And as it happens, over the last couple of years, both hospitals have adopted and integrated AI, very specifically in radiological imaging. And they have done this quite judiciously, very cautiously, limiting the AI algorithms as a background reader, specifically for analysis and interpretation of the chest X-ray image. I think this has been the decision by the in-house radiologists. They haven't extended it by choice to say CT imaging. And I can illustrate, so how it works is, patients get a chest X-ray, which as you all know is a very, very commonly ordered medical investigation. And as the radiologist is looking at the image and he or she is reporting, the AI is running in the background, the software, the algorithm. Debatable whether you want to call it a first reader, second reader, or concurrent reader. But what my radiology colleagues share with us is that a pop-up box will appear, and in a matter of 5 seconds, they're getting the findings. The salient key findings are summarized. Now, our radiologists are all very experienced clinicians, and after some initial reticence, they actually like it. They tell me there's a very high concordance, about 95% of the findings correlate well with their own clinical findings. And it's demonstrated improved workflow, improved efficiency as well. I think there's a lot of data out there that chest X-rays for screening various lung diseases, including lung cancer, traditionally it's not good enough. But there's emerging evidence now when it's enhanced with AI, definitely enhances the diagnostic accuracy, the sensitivity, reducing the error. So your sensitivity, specificity, predictive values increase. But if I can just very briefly elaborate, where I see even greater utility for these AI-enabled chest X-rays, for example, certainly in a country like Malaysia and other sort of low and middle income nations, is even outside the hospital setting, in the wider healthcare landscape, in primary care. So I'm talking in terms of private or government clinics, clinic kesehatans up and down the country. Because this is precisely where we won't have a highly trained radiologist on site. So what happens presently in most cases is, you attend your primary care doctor, your GP, and if as part of the evaluation a chest X-ray is deemed to be an essential investigation, it gets ordered, it gets done. Sometimes the X-ray is done at that practice, sometimes you're sent to a different facility. And then there's a turnaround time which can range from days to even up to a week before you get the report or the image reported. With AI technology, and we have done this in unfortunately, Mahesh, pilot study, although I want to be a fighter pilot, we have demonstrated that, a lot of the software we used is what is being used as well by the ministry, and I'll elaborate in a minute, but a lot of this is cloud-based. So you can have a digital or analog image, can be uploaded to the cloud, and in a matter of minutes, it will generate a detailed report, which is commensurate with that of a very experienced radiologist. And what that does is it empowers the primary care doctor in the clinic, in a clinic kesehatan, in a private clinic, up and down the country. He or she is then empowered on the next course of action. Now that might be to prescribe a course of antibiotics and a follow-up scan in a few weeks. It might be to refer on to a lung specialist. It might be to refer for a definitive CT scan. But we shorten the turnaround time. And when we're dealing with serious lung diseases such as lung cancer, tuberculosis, the time to diagnosis, the time to treatment intervention is critically important, impacts on outcomes. And so, you will probably be aware the government of Malaysia, through the Ministry of Health, has embarked on this very, very ambitious, but in my opinion, much needed lung health initiative, where we shine a light on lung health, lung diseases, lung cancer being a big part of that, given that we have a high disease burden and a preponderance of late-stage disease in our country, but also to look at the communicable and non-communicable benign lung diseases, COPD, asthma, and so forth, TB, tuberculosis. And so KKM, Ministry of Health, has rolled out this initiative. The bedrock of that is to use AI-enabled chest X-rays, because although a CT scan is, the gold standard, there are issues of cost, accessibility, affordability, as well as some concern about radiation. And I'm happy to share that the work that our NGO, I lead an NGO called Lung Cancer Network Malaysia, and we pioneered, regrettably, a pilot study, a proof of concept study, but that really provided the evidence base, the foundation for the Ministry of Health to kick on with this lung health initiative. So I think, the short answer to your question is, this technology is here to stay, but we have to be judicious in how we adopt it and integrate it into the workflow. I see immense potential starting out with imaging, but obviously it can extend to pathology and other parts of the hospital or health system workflow. And great potential as well outside the hospital system, where you can triage, you can deploy this remotely access rural and remote populations, utilize, as we discussed, Wilson, telemedicine and so forth. So we can really democratize access to healthcare. And ultimately what we want to do, I'm using lung as an illustration because it's my area of work, we want to expedite the whole diagnostic and referral of any suspected case of lung disease, and of course, most importantly, lung cancer. Get that individual in the hands of the relevant lung specialist. Yeah.
Right, thank you very much, Prof. Anand, for the sharings. So I think there are a few points I think you make, which one thing is the AI could be very benefit for like urban area where we don't have a radiologist. I think that's, I know that we have a lot of urban area that we don't have the facilities and then the specialists. If the citizens from the urban area, from the kampong, want to go out to the cities, it also takes a lot of time and also costs. So that would definitely helps in those places.